Hi, I'm Mrs. Princey, Associate Professor in Mental Health Nursing. Recording is an essential and a very important function in any organization if you take. So, if you take a business enterprise, if you take a hospital, if you take any kind of an institution, they will have to do the recording, right? Recording is done in different ways in different organizations. So, one of such recording is even done in the field of psychiatry. Yes, so the recording which is done here is the interaction between the nurse and the patient. The recording which is done here in the psychiatric field is the interaction between the nurse and the patient. Yes, so the topic for the discussion is about the process recording. So, as the name says, the process. What do you mean by process? The process of the interaction is being recorded. Okay, so that is called as the process recording. Now, let us see the definition of process recording. Process recording is the written account or the verbatim recording of all that transpired during or immediately in the nurse-patient interaction. Yes, in other words, we can say it as the recording of the interaction between the nurse and the patient during or immediately after the interaction. So that is called as the process recording. The recording can be done or it can be written immediately after the interaction or during the interaction when there is a one-to-one interaction. Okay, so that is the definition of the process recording. Moving on to the purposes and the uses of the process recording. Number one is the process recording helps in the quality interaction and also it will bring about the effective interaction between the nurse and the patient. The second thing is it is a learning process for the nurse wherein she can develop the clinical interaction skill. That is another use or the purpose of the process recording. It will help the nurse or the student nurse to plan, to structure, and to evaluate the interaction at the conscious level rather than the intuitive level. It helps the nurse to gain the competency in interpreting as well as synthesizing the raw data. Yes, so what is the interpretation that can be done and what is the raw material that has been got during the interaction. So that will help the nurse to improve our competency in the evaluation of the record. It will help the nurse to develop the awareness about the verbal and the non-verbal cues or the interaction process that the nurse will use when she is interacting with the others, and the modifications can be done when she knows the verbal and the non-verbal cues which are not appropriate. She can bring about the changes in her communication patterns. It helps the nurse to understand her thoughts and feelings not only about her own self but also about another patient here, the client. It helps the nurse to improve her observational skills since the process recording is a conscious process wherein you are going to learn about the thoughts, sort the thoughts, and also interpret the particular thoughts. So, it is going to improve the observational skills of a nurse. It helps the nurse to identify the problems of the patient and also help in solving the problems of the patient. So a nurse can, start using this process recording unconsciously, even when she is not having the sufficient time to actually do the process recording. Unconsciously, it will become a practice for her to follow this particular process, which is very much important. So thus we can say that the process recording is an educative tool for the nurse. For giving the health education to the patient, she can also learn how to modify her communication pattern. It is a teaching tool. Okay, it is a diagnostic tool to diagnose what the problems of the patient is, and also it is a therapeutic tool. Once you know the diagnosis, you can plan the treatment for the So we can say that these are nothing but the prerequisites for the nursing process, which are very much important, when we start with the nursing process. Yes. So these are the purposes or uses of the process recording. Moving on to the prerequisites of the process recording. So before we start the process recording, few things that we have to keep ready. So one is the physical setting. The physical setting should be in such a way that the privacy has to be maintained, the room has to be well lighted, and also it has to be calm and quiet so that the interaction between the nurse and the client will happen in a comfortable zone. So one is the physical setup. Second thing is you have to get the consent from the patient. If you are using any means of recording in terms of cassette recording, video recording, tape recording, so if you're using those kinds of equipment for recording the interaction, which is later on going to help you out in the treatment process and the diagnosis, then you need to take the consent from the patient. The third thing that is required is the confidentiality. Very, very important. What happens between you and the nurse, the interaction should be always kept in confidence. You should not share such kind of an interaction with the other people or the other family or the client unless and until it is required for the medical purpose. And you can communicate this to a mental health team which will aid in the diagnosis as well as the treatment. So these are the prerequisites of the process recording. The first one is the introductory material. So in the introductory material, it is very, very important to record the thoughts and feelings of the nurse before she starts the interaction. Okay, so very important, what are the thoughts of the nurse, the feelings of the nurse before the interaction to be recorded, because if the nurse, is having a personal problem, or if she is having something in her mind, preconceived ideas, or she is into a lot of stress, so those can also be reflected in the interaction. So very important to note down what is the thoughts and feelings of the nurse before she does the interaction. The next thing that you have to keep in mind is you need to know why you have selected, the reason of selecting the patient, and also the duration of the nurse patient interaction becomes very, very important to be included in the process recording. Why the particular process recording is done, the reason behind the goal behind the recording, and what is the duration, expected duration of the process recording that has to be included. So, to understand more about the patient, you need to also include the brief data about the history of the patient in terms of the educational history, the personal history, or it can be the present history, past psychiatric history, what are the treatment history, what are the provisional diagnosis of the patient, all the family history. It's a baseline information or a brief history of the patient to be collected to understand more about the patient. So these are the things which is done in the introductory material that you have to keep in mind. The next one is the objective. So what is this objective? So objective here is nothing but the goal of the process recording. What is the goal? It can be different at different times, right? So say for example, at present, my goal or my objective was to do the diagnosis of the condition. Maybe tomorrow, maybe I have a goal or objective to plan the treatment. For that, have underwent this, process recording. So at different time, the reason or the goal may be different. For example, in the beginning, the goal is just to set the short-term goals, but later on, the goal may, expand. Maybe you may have to set the long-term goals. So the objective of the process recording to be kept in mind. The third one is the working phase. So what happens in the working phase? In the working phase, the objective can be shifted to a long-term goal. Okay, so long-term goal, it can be related to bring about the improvement in psychodynamics of the patient, to improve the relationship of the patient with the friends or family, to solve the family problems. So that can be a long-term goal which happens in the working phase. The rehabilitative services, the follow-up, and the future plan. So all these are some of the examples which can be done in the working phase, which is having a long-term goal. So moving on to the next one, which is recording the interaction between the nurse and the patient. So it is a very important process. Okay, we are doing the recording. So here in this process of recording, you have to include, in a honest way or in a truthful way, what the nurse said and what she did, and what the patient said and what he or she did. So both the verbal and the non-verbal communication, what happened between the nurse and the patient, has to be recorded in the step of recording the interaction. So the non-verbal behavior from the client's end, it can be changing the position, looking at different things, okay, not maintaining the eye contact, he may be biting his nails. So all these are the non-verbal communication from the client's end. So all this information has to be recorded. So both the verbal and non-verbal information from the nurse's end as well as the client end should be recorded in this step. Not only that, the nurse's thoughts and feelings also should be recorded, because she can also analyze her own self. How was she when she was doing the process recording, and she can modify and do a learning experience for her to bring about a change in the communication. The last thing what is done is the analysis of the interpretation, right? So what is done here is the nurse will be doing the interpretation of both the verbal and non-verbal communication which happened, and she will be analyzing the behavior of the person. She will be evaluating the behavior of the client. She will analyze the thoughts, the feelings of the client, which will help in the diagnosis, or it will help in the treatment process. She should also include the communication techniques which is used, right? So the nurse may use various communication techniques in the process of interaction. So how far this communication technique, whatever she used, was effective on the patient, what was the response from the patient end for this type of a technique what she used, so that has to be included in the recording. At last, you are going to include the nurse's thoughts and feelings at the end of the interaction. What is the nurse's thoughts and feelings about it? About the interaction. What are the future plans? So when has she planned for the next process recording? So all these information has to be included in the last step of analysis of the interpretation. So let us see the duration of the process recording. So process recording can be done, okay, in the written form. Okay, the recording can be done immediately after the interaction or during the interaction. So during the interaction, she can just briefly note down, but after the interaction, she has to rewrite in detail about the process recording. If we take the duration of the process recording, the whole process recording takes about 30 minutes. The 20 minutes is the active interaction which happens, and the last 10 minutes the nurses can use for writing the conclusion and also for recording. So the actual writing the process of interaction. So this is the overall duration of the process recording. So here I've got a format for you, okay, about the process recording. So you initially collect the basic, the baseline data of the patient name, age, date of admission to the hospital, the date, the time, and the objective of the process recording is very, very important. What are the objectives? 1, 2, 3, 4. Okay, what are the short-term objectives, or if it is a long-term objective, what is the long-term objective? That has to be stated. And you have to have a tabular column, okay, wherein you're going to record the response of a nurse and the client. So both the verbal and non-verbal responses from the nurse and the client, verbal and non-verbal response, what is the communication technique that the nurse used during the interaction, and what is the nurse's inference about the interaction. Very much important. You have to mention the conclusion and the summary of the process recording. So this is the format of the process recording. So process recording is nothing but a very important recording of the interaction between the nurse and the patient, which is very much vital with various and different goals, okay, which is going to help in the treatment process and to bring about the maximum or the positive effect from the patient's end. Hope you all have understood the topic.